I'd like you to meet someone who can't be with us today. This is Toby. He is my funny, loud, lovable 26-year-old son. He's also non-verbal and autistic, with a cognitive level that's equivalent to a mainstream 2-year-old. So he loves Mr. Tumble, playing hide and seek, and he'll steal your mobile phone in the blink of an eye, hoping to access YouTube. Toby was born with a condition so rare that he's the only known person to have it, and he was never expected to live to adulthood. I can't even begin to tell you how close Toby and I are. We came so close to losing him so often in his first few years. When you spend that long standing by your child's bedside, just willing them to keep breathing, it consolidates what is now an unbreakable bond between us. I never wanted Toby to leave home, but I had no option. I have stage 4 cancer with a poor prognosis, and I owed it to Toby to find him somewhere great to live and to still be around well enough and alive long enough for him to settle in properly. What's been incredibly hard, though, is the past few months. I've not been allowed to see Toby since the 15th of March due to government guidelines to keep care homes COVID safe. I miss him so much that it hurts, but at least I can understand why I can't see him. Toby has no clue why he can't see me. I worry so much about the psychological damage this must be causing him, and being non-verbal, he can't even ask why. Although I understand why the rules are in place, it feels as though we've gone backwards by several decades. We've effectively returned to a time when our vulnerable family members are locked away and kept apart from us. Due to my diagnosis, I've been shielding since March, only leaving the house for cancer treatment. So my risk of passing on COVID to Toby is virtually nil. On social media and on the news, I see photos and videos of crowds of people out and about, yet we can't even see each other. It feels like the worst form of disability discrimination. Far too many of the one-size-fits-all COVID restrictions have unfairly impacted far too heavily on families like mine. As Toby got older, his health improved, but instead he developed extreme behaviour. Everyday violence became our way of life for over 8 long and terrifying years. Most days I didn't know how I would keep all 3 of my children safe right through until bedtime. Sadly, often I couldn't. Toby had an amazing team of professionals supporting him, and I talked to all of them. Nobody knew what to suggest. There weren't any appropriate services that might help. Everyone I approached seemed shocked that this was happening. Nobody had any answers. Toby's violence was apparently very unusual, and they'd seen nothing like it before. The more I asked for help, the less help I seemed to get, and slowly the narrative changed. The more I asked, the more I got blamed. It had somehow become my fault. When a mother gets repeatedly told that their child's behaviour is all their own fault, something quite profound happens. That mother starts to believe it too. It's only a tiny step from believing that it's all your own fault to also believing that you must deserve to be being badly hurt by your own child every single day. It took a long time before somebody told me that anxiety was the most likely cause of his behaviour, that all behaviour was a form of communication, and that every time Toby hurt me, he was actually trying to tell me how frustrated, distressed, confused, and unsafe he felt in the world around him. For me, that was a game changer. My whole approach towards him changed, and I started working with him to rescue him from his own violent behaviour. It's a very long time now since he was a risk to anyone. Instead, he's happy, living a great life, and his future looks so much more promising. However, I still believed that Toby's behaviour had all been my fault for a very long time, and that we were the only family that had ever been through this. Then 3 years ago, I found these 2 pieces of research, 2 studies, one from the United States with 1,800 families of autistic children, and one from Ireland, which looked at adults with a learning disability. In each study, they found that the prevalence of aggressive behaviour was around 50%. That day that I found this research was the day that I knew that none of this had ever been my fault, and that nor is it ever a child's fault either. A child lashes out to hurt others not because they're spiteful or naughty, but because they're frightened and confused, and they don't feel safe in their immediate environment. Anxiety causes this behaviour, although anxiety can look quite different to what we expect it to look in children. Very anxious children can be angry, they can lash out and hurt other people, they can damage property and possessions, they can be verbally abusive or pick on their brothers and sisters. They often avoid all demands and they often become very controlling. It's now 17 years since Toby first hit me, and yet parents are still being blamed. Very few services have been developed, and staff that support these families still get no training whatsoever in this issue. I now do everything I can to support these families. It's become my bucket list project. Due to this work over the past 3 years, we now know of well over 600 success stories. Families who have helped their children move beyond their violent episodes and who are now happier and calmer and with much more hopeful futures. As part of this work, I now support 6,500 families in a private Facebook group called the SEND VCB project. SEND VCB stands for Special Educational Needs and Disability, Violent and Challenging Behaviour. These families are some of the most vulnerable that we have in the country, and the children are those who are often destined to end up in either the criminal justice system or in an ATU until someone steps in early enough to empower the parents by encouraging them to develop different and more effective parenting skills. ATUs stands for Assessment and Treatment Unit. They're locked wards in psychiatric units where sometimes children with learning disabilities or autism and young people can end up living there for literally years upon years. Every family in the group who has a child with an additional need, so this is the group I support, and every family in our group has a child with an additional need who's also physically violent towards other people. Most of the group's children are autistic or they have a learning disability or both, but there are many other conditions represented as well. The ages of the children range from 3 to 18, and about 1/3 of them are girls. The children are educated across a mix of settings, including mainstream, specialist or residential schools. Many are home educated, generally due to repeated school placements failing or because they can't find a school to meet their needs. Violent and extreme behaviour in children with additional needs does not discriminate. There are professional members in the group, including hospital consultants, head teachers, barristers and social workers, as well as families who are living in poverty. However, they all have so much in common, including courage, tenacity, resilience and motivation, not to mention a totally unwavering love for their children. They are the ninja parents. It's honestly the most difficult version of parenting I know. One of the first things parents hear me say is when I tell them that none of this is their fault and that it's not their child's fault either. This simple statement can have a profound effect. Blame, shame and judgment and an assumption that bad behaviour is always caused by poor parenting skills are incredibly common opinions, and they're just as likely to be held by the staff working with a child as by extended family members or difficult neighbours or those tut-tutting people in the Tesco car park. Being blamed and not being believed are the two biggest issues that come up again and again in discussions in our private Facebook group. This is a quote from one of the parents in the group. When we're broken and we're asking for help, please listen. We've already tried and utilised more tools from our toolboxes than most pet families amass in several lifetimes. If you don't have any more tools to offer, Please don't try dismissing us under the umbrella of bad parents and blame instead of supporting us. We've already proved ourselves to be ninja parents. We continually pick ourselves up, trying to hold ourselves together for our kids and to be their advocates. If you cannot help, the very least you can do as a human being is to listen. Just listening can help so much. We're not expecting a magic wand, although that would be very welcome. But when someone listens, it's so appreciated. Reasonable adjustments also don't have to be all about funding and resources. The most powerful one that you can make is the one you choose to make in your own heart, to seek to understand and support with compassion and humanity. Kindness costs nothing, but it can mean everything. It can make a huge difference. This community in our group have had it tough during the pandemic. When schools closed, services were withdrawn, paid carers were cancelled, and health services were suspended, everything was pushed onto mum and dad, all day, all night, every day for 6 months. Even with an EHCP, very few schools allowed children with behaviour issues to attend throughout lockdown. How are these children going to fare with so many schools imposing zero tolerance behaviour policies now they're going back to school? We're told that these policies are to keep people safe, but even though discrimination may not have been the intention, it's likely to be the outcome when the children who are the most difficult, as well as being the most vulnerable, are excluded in the coming days and weeks of this new term. We must change the way that we support families. These parents are my pandemic heroes. They are exhausted, broken, and crushed by what they've had to cope with over the past 6 months. If we want to reach their children to offer help and support, first we must help their parents heal and recover. How do we do that? It's simple. Please listen, please believe them, and please just let them know what a fantastic job they're doing. And if you can, please tell them from me that they absolutely rock. Thank you.